Hello everyone. Here we are going to cover a very important topic, that is Polycythemia Vera. You usually get a short note on that, especially on its pathophysiology and the major and minor diagnostic criteria. So let's start the topic. We are starting a topic that is Polycythemia Vera. Now, first of all, I will let you know the overview under which I'm going to discuss this topic, the headings under which I'm going to discuss this topic. So first of all, I will let you know the definition of Polycythemia Vera. What is Polycythemia Vera? Then the most important, we see its pathophysiology or etiology, etiogenesis. Then we will see its diagnostic criteria given by the WHO, the major criteria and the minor. I will let you know the 3 major and 1 minor criteria. Then we will see its clinical feature and lab diagnosis. So let's start the topic. So before starting the definition of Polycythemia Vera, you must understand the WHO classification of lymphoma. We divide the lymphoma according to WHO classification under 2 categories: the WHO classification of myeloid lymphoma and the WHO classification of lymphoid lymphoma. So the WHO classification of the myeloid neoplasm, here we divide them into 5 categories. One of the category in myeloid neoplasm is myeloproliferative disease, and one of the myeloproliferative disease is Polycythemia Vera. So I mean to say, the topic I am teaching you right now, Polycythemia Vera, is one of the myeloproliferative disease which comes under WHO classification of myeloid neoplasm. So that you must understand. Now, what is the problem here in Polycythemia Vera? What is happening? It is a clonal disorder in which there is increased production of all the myeloid elements that leads to pancytosis. So there is increased RBC, increased WBC, increased platelet. We know in the blood there are 3 types of cells: the RBCs, the WBCs, the platelets. All the cells are formed in the bone marrow. Here you can see this is the bone marrow. This is the hematopoietic stem cell, which give rise to RBCs also, which give rise to WBCs also, and which give rise to platelets also. Once they are formed, they come in the peripheral blood. The precursors don't come in the blood, but final product, the RBC, WBC, and platelet, the mature forms comes in the blood. This is hematopoiesis. Hemato means blood cell, poiesis means synthesis. So synthesis of blood cells taking place in the bone marrow from the hematopoietic stem cell. How these cells are formed? Now, RBC don't have any further type. RBC don't have any type, platelet don't have any type, but WBC is of 5 type. 3 of them are granulocytes, having granules in the cytoplasm, that is neutrophil, eosinophil, basophil, and 2 of them are agranulocytes, they don't have granules in the cytoplasm, that is monocyte and lymphocyte. So total 5 WBCs are there. So basically there are 5 WBCs, 1 RBC, 1 type of RBC, and platelets. So total 7 type of cells are formed. So how does they formed in the bone marrow? So the first cell is hematopoietic stem cell. It give rise to 2 progenitor. So myeloid stem cell or myeloid progenitor, and lymphoid stem cell or lymphoid progenitor. The myeloid progenitor give rise to all RBC, it give rise to all platelet, and among the 5 WBC, 5 type of WBC, 4 of them are formed here. That is neutrophil, eosinophil, basophil, and monocyte. Lymphocyte is not formed by the myeloid progenitor. The lymphoid progenitor give rise to lymphocytes. Okay, so what is happening here? Here there is clonal proliferation in Polycythemia Vera. I am saying there is clonal proliferation. There is clonal proliferation of the myeloid elements. All the myeloid elements, there is clonal proliferation. So there is increased production of RBC, increased production of platelet, and increased production of WBC, basically from the WBC, the granulocytes. So there is increased production. So increased production of RBC, WBC, and platelet together is known as pancytosis. Pan means all 3 types of cells, all the 3 lineages. Cytosis. Cytosis means increased in number, not decrease. It is not pancytopenia. Pancytopenia is reduction in number. Here we are talking about pancytosis. So what is the definition of Polycythemia Vera? There is clonal proliferation of the myeloid elements. So there is increased production of all myeloid elements. So patients have more RBC, more WBC. Among the WBC, mainly granulocytes and more platelets. Not the lymphocyte here in the WBC, because lymphocyte is formed from the lymphoid origin. Here the myeloid origin elements are more in number. So that is pancytopenia. So here also you can see all the cells, how they are formed in the bone marrow. You all can appreciate. The first cell is hematopoietic stem cell. It gives rise to 2 stem cells, the myeloid stem cell, the lymphoid stem cell. The myeloid stem cell gives rise to RBCs also. It gives rise to platelet also, and it gives rise to 4 type of WBC out of 5. But the lymphoid stem cell, here you can see the lymphoid stem cell gives rise to lymphocytes only. So in Polycythemia Vera, there is increased production of the myeloid elements because of clonal proliferation. Now, what is the pathophysiology? Why the myeloid elements are increased in their number? Why? Because it is a mutation. The name of that mutation is JAK2 mutation, tyrosine kinase JAK2 mutation. Let me tell you, can you see how does the RBCs are formed in the bone marrow? Can you see?